The Westnile and Rwenzori regions are experiencing improved healthcare delivery thanks to a 4-year project titled Leveraging Strategic Health Financing for Universal Health Coverage. The Federal Kingdom of Belgium, through its development agency Enabel, has invested 4 million euros in the Ministry of Health. This funding aims to provide basic equipment to health facilities, support regional equipment maintenance centers, and supply solar power and wash facilities to emergency units.
The Ministry of Health in Uganda allocates significant funds for procuring healthcare equipment and tools, yet there is frequently breakdown due to preventable causes. The health workshop manager, Rwenzori Region, Engineer Kasami Joe, says many technical and healthcare providers are unable to properly operate medical equipment due to lack of exposure and advancing technology, resulting in frequent breakdowns and deteriorating healthcare services.
When Enabel came in, the equipment functionality, the percentage was a bit low. But when they came with the interventions, training users, providing spares, funding for technicians to go out and carry out activities, at least the facilities, at least they was able to move to more than 11 facilities, up to 27.
The Kingdom of Belgium, through the Belgian Development Agency, Enabel, has invested 4 million euros to improve the quality of healthcare and hospitals in the Rwenzori and Westnile region. By building and equipping healthcare infrastructures, Enabel collaborates with the Ministry of Health to increase geographical access to quality healthcare.
We have achieved a lot, countless to mention, but access to health services or basic health services has improved across time. We're talking about access to vaccines, we're talking about access to maternal care, just like how the policies guide us that a mother should have a minimum of 4 visits, and so we've been able to move, antenatal care services.
Enabel's collaboration with the Ministry of Health workshops has underscored the significant need for support in equipment preventive maintenance, repairs, and user training. Under the Leveraging Strategic Health Financing for Universal Health Coverage project, many technicians and medical workers have been retooled.
You'd find, like in the care of neonates, the newborn, they bring incubators, they bring warmers, they bring concentrators, they bring oxygen splitters, but we don't know how to use them. We've been in health facilities, you find it is new the way they brought it. Nobody wants to use it. All they are using it in a box. So we went down there after getting training, also sponsored by Enabel.
Trained on how to use our machines like the incubators, warmers, and how to connect the oxygen, how we can utilize our oxygen.
The project focuses on improving the utilization and quality of healthcare services, such as reducing maternal and child mortality, improving immunization rates, and enhancing access to essential healthcare services.
Every time we've got, for example, babies that really needed a service that needs 24 hours of oxygen with a very unreliable power grid, that was already a problem. So the fact that Enabel came on board and then gave us the solar systems, at least we're now able to run all our machines comfortably without issues.
Before Enabel came in to support us with the solar system, generally we used to have difficulties with supporting the machines because we had powers on and off.
Enabel has facilitated maternity wards, including neonatal intensive care units, theaters, and inpatient wards in the 2 regions with solar power installations and procurement of medical support equipment in the last 4 years.
To begin with, Enabel supported capacity building, helping us to learn and get new skills and knowledge to manage mothers and babies. And under that, we've been able to have nurses and midwives trained to handle emergency medical services.
With such interventions, there is no doubt that maternal and child mortality levels will significantly reduce.